Hello, good morning everyone. Myself Urezi Rehana from Knowledge Institute of Nursing. So today we are going to see about nursing management in common childhood illness. So first we will learn about cardiovascular system. So in that congenital cardiovascular disease. First let's learn about heart. So we have already learned about anatomy and physiology of heart in our previous year. So let's revise it once again. The physiology of heart. So in heart, the deoxygenated blood comes from all over the body parts to superior vena cava and inferior vena cava. This deoxygenated blood enters into the right atrium and passes through the tricuspid valve and enters into the right ventricle. Then from right ventricle, the deoxygenated blood goes to the pulmonary artery, and from pulmonary artery there are two branches, that is right pulmonary artery and left pulmonary artery. So from these both pulmonary artery, the blood goes to the lungs. Now in lungs, the blood gets purified and the oxygenated blood now enters through the pulmonary veins into the left atrium, and from left atrium it enters into the left ventricle. Between left atrium and left ventricle there is mitral valve. Now from left ventricle the blood goes to the aorta. In aorta there is aortic valve. Then from aorta the blood, that is oxygenated blood, is supplied to all the body parts. Now, as we are in pediatrics, so let's learn about fetal circulation. So, in fetal circulation, first let's see some terminology. So, first is foramen oval. So, foramen oval, it is an opening between right atrium and left atrium. Then, arteriosus. So, ductus arteriosus, it is a hole between pulmonary artery and aorta. Then next is ductus venosus. So, ductus venosus, it is an opening between or hole between umbilical vein and inferior vena cava. So this is the terminology that we must remember in fetal circulation. Now let's see the fetal circulation. So in fetal circulation, first the placenta is attached to the uterus of the mother. So from mother, oxygenated blood comes through the placenta. Then from placenta, it enters into the umbilical cord. So in umbilical cord, there are three total blood vessels. That is two arteries and one vein. So the oxygenated blood comes into the artery, that is umbilical vein, and it goes to the inferior vena cava. Then in inferior vena cava, there is ductus venosus. So ductus venosus, so in that there is mixing of oxygenated and deoxygenated blood, because ductus venosus is a hole between pulmonary artery and aorta. Now the blood goes into the right atrium, that is mixed blood goes into the right atrium. Then from right atrium there is, we have seen that there is foramen oval, that is opening between right atrium and left atrium. So from right atrium the mixed blood goes to the left atrium. Then from left atrium, this deoxygenated blood goes to left ventricle. Then from left ventricle, it goes to the aorta. From aorta, this mixed blood is supplied to whole body. Then finally, it comes to the internal iliac artery. Okay, that is hypogastric artery. So hypogastric artery is formed by descending aorta. The descending aorta is divided into two, right and left iliac artery, and this right and left iliac artery is again divided into internal and external iliac artery, and this iliac artery comes out as hypogastric artery. So when comes out of body, this artery is called as umbilical artery. So at last, this blood is supplied to the umbilical artery, and from umbilical artery, this blood goes to the placenta. So this is the fetal circulation. So we have seen the pathway of fetal circulation. Now we will learn about congenital heart disease. So in congenital heart disease, This is the definition first. That is neonatal birth with any structural defect of heart or malformation is called as congenital disease. Okay. So here what they are telling that whenever any birth of neonate is occurred that is having any defects in heart or malformations are present, that is called as congenital disease. Means these disease conditions are present in neonates by birth only. Incidence of this is all over congenital heart disease is about 6 to 8% per 100 live birth, and between birth to 10 years 2% of total death occur due to congenital malformation of heart. Now etiology. Etiology means causes. So first there is no exact cause. Okay, so it is unknown, but some causes are maternal rubella and teratogenic viral infections like herpes simplex virus. Then teratogenic effects of drugs such as thalidomide consumed during pregnancy and alcohol. Okay, so if mother is consuming these drugs, that is thalidomide drug during pregnancy. Otherwise, if mother is consuming or taking alcohol during pregnancy, so this will cause teratogenic effects. Then other causes are maternal insulin dependent diabetes. If mother is having this insulin dependent diabetes, then family history. If in family someone is having history of this congenital heart disease, then genetic factors like genetic disease like Marfan syndrome, Holt-Oram syndrome, Turner syndrome, Williams syndromes, these are the genetic factors, and at last chromosomal defects. These are all the causes of congenital heart disease. Now classification of congenital heart disease. So congenital heart disease are divided into two, acyanotic and cyanotic. So in acyanotic, why they are telling us acyanotic? Because no symptom like cyanosis is not seen in this condition. Okay, acyanotic is further classified into increased pulmonary blood flow and obstruction to blood flow from ventricles. So in increased pulmonary blood flow, the congenital heart diseases are first is atrial septal defect, then ventricular septal defect, patent ductus arteriosus, and atrioventricular canal. Then in obstruction to blood flow from ventricles, coarctation of aorta, aortic stenosis, pulmonic stenosis. Okay, then in second classification, that is cyanotic. Okay, why they are calling it as cyanotic? Because in these symptoms like cyanosis is seen. So in cyanotic, it is further divided into decreased pulmonary blood flow and mixed blood flow. Then in decreased pulmonary blood flow, the disease condition are tetralogy of palate and tricuspid atrasia. In mixed blood flow, transposition of great arteries, total anomalous pulmonary venous return, truncus arteriosus, and hypoplastic left heart syndrome. So these are all the congenital heart disease as per the classification. Now these are all overall signs and symptoms of congenital heart disease. So those units who are having congenital heart disease, we will see these of the symptoms. That is, many congenital heart defects have few or no sign or symptoms. It depends on the number, type and severity of the defect. Okay, now sign and symptoms are tachypnea and tachycardia. That is, respiratory rate will increase as well as heart rate will increase. Then recurrent respiratory infection. That is, those neonates who are having this congenital heart disease have more chances of getting respiratory infection. Okay, recurrently they will get the respiratory infection. Then cyanosis, that is a bluish tint to the skin, lips and fingernails, and polycythemia. Then tissue hypoxia, so these are the sign and symptoms. Other symptoms are fatigue, that is tiredness, decreased exercise tolerance. So those neonates or child who are having congenital heart disease, if they are doing some exercise also, that is mild exercise, then also they will get tired and they can't tolerate such exercise. Then abnormal heart sound, especially murmur sound, will be present on auscultation. Then growth retardation and cardiac failure. Diagnostic tests are physical examination, then echocardiography, EKG, that is electrocardiogram, chest X-ray, pulse oximetry, cardiac catheterization, and blood studies. Okay, so this was overall about cardiovascular disease, congenital cardiovascular disease. Now we will see this all congenital cardiovascular disease one by one as per the classification. So first classification in acyanotic was defects with increased pulmonary blood flow. Okay, why they are telling it is increased pulmonary blood flow? Because here the pulmonary blood flow that it is increasing. Okay, in blood circulation there are two circulation, that is systemic circulation and pulmonary circulation. So when the blood circulation occurs between heart and other body systems, that is called as systematic circulation. And when blood circulation occurs between heart and lungs, that circulation is called as pulmonary circulation. So here in this condition, pulmonary blood flow is increasing. Okay, so our first congenital heart disease is atrial septal defect, that is ASD. Okay, definition is ASD is a congenital heart defect in which abnormal opening between the right and left atrium which allows blood flow from higher pressure left to lower pressure right. It is also called as left-right shunt. Okay, in ASD, it is a firstly it is congenital heart defect. Another is there is abnormal opening is present. Okay, so in ASD, abnormal opening is present between right and the left atrium. See, you can see in the picture. So between right and left atrium, abnormal opening is present. So because of this opening, what happens? Left side of the blood flows into the right side. That is from left atrium to right atrium. Okay, why from left atrium to right atrium? Because on the left side of the heart there is more pressure, because left side of the heart has to supply the blood to whole body, to all the systems. Okay, and whereas right side of the heart has to supply the blood to lungs only, and lungs are very close to the heart, not at a far distance. So at right side of the heart there is low pressure as compared to the left side. So in ASD, the blood will flow from left atrium to the right atrium. So that's why it is called as left-right shunt. Okay, now types of ASD. So there are three types of ASD: Ostium Secundum, Ostium Primum, and Sinus Venosus. Ostium Secundum means it is most commonly that is seen in 50 to 70% of the neonates, and Ostium Secundum it is present in the middle of the septum in the region of foramen oval. Okay, so where foramen oval is present, that is between right atrium and left atrium. Okay, foramen oval was there. So at that location only, if an abnormal opening is present, then it is called as ostium secundum. Then second is ostium primum, that is seen in 30% and it is present at low position. It is form of atrioventricular septal defect. Okay, so you can see in the picture ostium primum, it is present at the lower side. Then sinus venosus, it is least common, seen in 10%. Site is at the entry of superior vena cava into the right atrium. So where the superior vena cava enters, at that location, this sinus venosus is present. So there are three types: ostium secundum, ostium primum, and sinus venosus. Causes are any problem in fetal development, abnormal chromosome, defective gene, or family history, then environmental exposure. Clinical presentation, that is sign and symptoms, are most infants and children are asymptomatic, but over years to decades may experience the symptoms depending on type and severity of ASD. Okay, so most of the infants and children, they don't show any sign and symptoms, but after years, after 10 years to they will experience some of the symptoms, and these symptoms depends on the type and severity of atrial septal defect. Okay, now symptoms are infant gets tired during feeding. Okay, so when mother is giving breastfeeding to the infant, then infant gets tired. Then child gets tired while playing or eating. Okay, so when infant is grown up and it becomes child, so when the child is playing or eating, so at that time the child gets tired. Then shortness of breath, fatigue, sweating, palpitation, and stunted growth. So these are the signs and symptoms of atrial septal defect. Diagnostic tests are history taking, physical examination, chest X-ray, electrocardiogram, echocardiogram, and cardiac catheterization. So this is the X-ray of chest. Then electrocardiogram. So electrocardiogram shows the electrical activity of the heart. Then echocardiogram. So echocardiogram uses the ultrasound, and in that we can identify where the abnormal opening is present. This is ASD on 2D echo. Then ASD flow by colored Doppler. Okay, now next test was cardiac catheterization. So in cardiac catheterization, a long thin tube called catheter is inserted in an artery or vein in your groin, neck or arm and threaded through your blood vessels to your heart. Okay, so cardiac catheterization, this procedure we can use for diagnostic purpose also and for surgery also. So in cardiac catheterization, a catheter will be passed from your artery or vein, okay? And this catheter then goes into the heart, and we can identify for diagnostic purpose also and for surgical purpose also. Okay, now let's see the management of atrial septal defects. So 20% of atrial septal defects will close spontaneously in the first year of life or as the child grows. So 20% of these ASD, so they will close spontaneously, okay? So they don't require any treatment. So within the first year of life, this ASD will get closed. Then for defects of 3 to 8 or smaller, so supportive medical management can be done, okay? So we have to check the severity of the defect. So if the defect is 3 to 8 or smaller than that, so we can go for medical management. So in medical management, digoxin, diuretics and prophylactic antibiotics are sufficient up till spontaneous closure, okay? So in medical management, we can give digoxin, okay? So digoxin helps to strengthen the heart muscles and it helps in regulating pumping. Then diuretics remove excess fluids from the body, and prophylactic antibiotic, it helps to prevent the infection. So we can give these drugs in medical management if the defect is smaller. Then if defect is greater than 8 surgical repair may be required. So if defect is larger, we can go for surgical management. If spontaneous closure does not occur by school going age, surgical repair becomes essential to prevent lung problems that will develop from long time exposure to extra blood flow. Okay, so we have seen in ASD that pulmonary blood flow is increasing, okay? So here what happens, we have to wait for a child going to school, okay? So till that age we have to see that whether spontaneous closure occurs or not. If spontaneous closure does not occur by school going age, then we have to go for surgical management because we have to prevent the lung problems. Now surgical repair defect may be closed with stitches or a special patch, okay? So we can close this defect with the help of stitches, okay? So sutures are taken and defect is closed. Otherwise we can also use a special patch, okay? So in special patch we are using the material utilized for patch closure of ASD may be the patient's own pericardium, commercially available buoyant pericardium, or synthetic material that is Gore-Tex or Tacron. So in special patch we can use pericardium, that is patient's own pericardium, okay? It is the layer of the heart. So we can use patient's own pericardium layer. Otherwise we can also use synthetic materials. In synthetic material then one can use Gore-Tex and Dacron. Okay, see, this is the picture of surgical closure. So we can do surgical closure by taking sutures and we can close the defect. This is pericardium layer, okay? So by using the patient's own pericardium layer we can close the defect. Then this is Dacron. So this is Dacron is passed through cardiac catheterization, and with the help of cardiac catheterization we are inserting Dacron at the site of ASD, that is atrial septal defect. So this will close this abnormal opening. Then this is the Gore-Tex, okay? So Gore-Tex, is also inserted with the help of cardiac catheterization and it is placed at the site of abnormal opening. So see, this is ASD device closure. It is as simple as it looks. So step 1, we are passing through cardiac catheterization and we are inserting it exactly where our abnormal opening is present. So I hope you all understood about atrial septal defect. Now next, that is ventricular septal defect, we will see in next video. So keep watching my video. Thank you everyone.